Hi, today's session is with Dr.Pavan Kumar Rasalkar, Senior Intervention Cardiologist, Manipur Hospital, Kanapur Road. So, I called you for I have discussed some basic questions. Most of you people are searching online, or most of you wonder suddenly why somebody died of heart attack, why somebody getting heart attack at the age. And so people have the impression that how technologically we can prevent heart attack risk. How we know, because we are living in a technology city. To answer all these questions, I welcome Dr. Pavan here. Welcome, Pavan. We'll start.
Thank you, sir. Thank you so much for having me here. It's all my pleasure.
So I'll ask questions on behalf of my audience.
Okay, sir.
So what questions usually public have about the heart diseases? The first question is, common myth is, so even while we are studying VVS MD hospital in that, till 50 women, the risk of heart attack in women is very less because estrogen has a protective effect. But for men, even at 30, they are at risk. So is this still valid?
Absolutely not, sir. These days, we are seeing many women in the reproductive age group. That's when their estrogen is at their peak, having major heart attacks even. Just a couple of months back, I had to stunt a 29-year-old young lady. In the last 6 months, if I take my personal experience, there have been 3 to 4 women less than 40 years of age who have had major heart attacks and ended up getting angiogram and angioplasties done. So there has been a shift in the trend of the heart attacks and cardiovascular diseases. What you're saying?
What do you think? Why women is getting heart attack at this age?
Now that is a very good question to ask. Women have estrogen in them, which biologically prevents heart attack. Then why women are having? See, for a heart attack to happen, there are numerous risk factors and there are protective factors. In the protective factors comes good lifestyle, good exercise, avoidance of bad habits, and in women of reproductive age group, the estrogen. But what has happened these days, the other risk factors have increased. Diabetes, high cholesterol, hypertension, and even women these days are getting involved in bad habits like smoking, excessive alcohol consumption, and even recreational drug abuse. And I would be missing out on a very big thing if I don't tell this: excess stress. Working women, especially balancing their families, balancing the work, and not sleeping well, not eating on time, having this chronic stress, which over a period of time, of course, affects the heart health.
I think this is one of the important factors. If women have to balance between home and workplace, thus give them a tremendous amount of stress. The second thing is, it's like healthy looking people, like okay, they are good, we don't know, healthy looking people also can have heart attack.
Absolutely. So I mean, this is nothing like people don't know. How many times have you heard an actor, a sports person, suddenly dying in the gym, suddenly dying in the sports field? Everyone wondering what happened. Such a fit guy, highly muscular, no bad habits, no risk factors, no cardiac history. Why this happens?
But coming in this, everyone is aware that Puneet Rajkumar's.
Yes.
So could it be sudden cardiac arrest?
Of course, it is sudden cardiac arrest.
So what could be the cause? Possible cause? You don't know exactly.
See, I'm not going to comment about what exactly happened in Dr. Puneet Rajkumar's case, but I'll tell you generally why such things happen in a seemingly fit-looking individuals without any traditional risk factors. First and most important, what I have seen in my practice is they have some risk factors. Undiagnosed sugars, undiagnosed high cholesterol, undiagnosed blood pressure. These are all silent killers. BP, sugar, cholesterol. In the initial stages, you will never know. They have no symptoms. Suddenly, they throw up a major event, then they'll come to know. So, in majority of these people, there are some kind of risk factors which have not been identified, and hence there is importance of routine yearly checkup. And some people will be having bad habits, like I said before, smoking, excess alcohol consumption, recreational drug abuse, and not to miss on it again, high stress levels. And one more important thing is over exercising. This I have impressed upon my patients a lot who come to me and ask what exercise they should be doing. Everything is a J curve. You don't do it or do it in less, it is troublesome. You do it way too much, it is again troublesome. So there has to be a moderation in the exercise, like minimum 30 minutes a day and maximum 1 hour a day. Beyond that, if you are really enthusiastic, in building your body muscles, that is okay. But for most of the population, 30 minutes to 1 hour of exercise, you should not be exceeding that. And there are certain genetic cardiac diseases like cardiomyopathies, wherein the heart muscle becomes weak and enlarged, which is called as dilated cardiomyopathy. Or if it becomes thick and enlarged, that is hypertrophic cardiomyopathy. In these conditions, the first event may be a sudden cardiac death. The patient may not have any symptoms at all. So it's only if you get your yearly checkup done, you get to know that you have this and you can take the necessary precautions to prevent a sudden cardiac death. So that, I think, explains why seemingly fit people are dying these days.
So I could recollect someday, usually I keep advising my patients, suppose if you had a disturbed sleep or too much of stress in the night, don't go for a morning exercise. Just relax first. When you are exercising, relatively keep yourself calm. Should not exercise during stress, because that can throw up into cardiac events.
Yes, you are absolutely right, sir. If you are not slept well, then your stress hormone levels are high, over that you excessively exercise, that may be detrimental to your body. Given a choice of good sleep and good exercise, I would choose good sleep first.
Yes, because many people, even if they don't sleep, they want to go in the morning, run in the gym, they want to do weight training. Please avoid that. And next is, everything is normal. People following, nowadays, some people are diet freaks. They follow typical good diet and they're exercise freaks. They sleep well. If everything is normal and if they are under too stress, only stress can lead to heart disease.
Yes, over a long period of time, yes. It's not an acute or short-term stress. Something happened in your office, something happened with your spouse or your family, you are stressed for 1 week, 2 weeks, not sleeping well. It's not going to affect you. You don't have to get panicked about it. But if stress has become a part of your life, chronically for years together, yes, it can have an impact on your heart health. It can in fact increase all the risk factors which can lead to a heart attack, like high sugars, high cholesterol, high blood pressure, which are all risk factors for the heart attack. And it can also have a direct effect on your cardiovascular system, leading to atherosclerosis and cholesterol buildup. But it takes a long time for stress to cause cardiovascular disease.
So I'll just add on to this. See, in human evolution, people are used to only acute stress. Plus, in ancient times, people only having the floods, famines, lack of food like this, only acute stress. After the normal, never seen the people the stress is. People have broken families. Somebody is going for a divorce, somebody is going for separation. They have a stress for many years. Some financial stress, many people are on EMIs, they go for financial stress for many years. And even the work, some people are working in the work, they don't like it actually. So these are the chronic stresses.
Yes, exactly.
Has more impact than acute stress of something. For example, you are writing an exam or a class, it's acute stress. That is absolutely necessary and not harmful. Any chronic stress will definitely harm the overall health, also heart.
You nailed it, sir.
So next comes to the one thing. Suppose a patient come to you, he did angioplasty, he had a heart block, angioplasty. So do you think that angioplasty, the stenting, is only the temporary measure, or what else you can do to completely reverse the heart disease?
Okay, now again a very good question. See, angioplasty is just solving the blockage issue. A blockage came in, you threw up an attack, or the blockage was critical, and we put in a stent, cleared the blockage. That is not the root cause treatment. That is a treatment to open the artery and keep you alive and keep your heart pumping well. The root cause treatment always is to reduce or completely remove the risk factor which led to the blockage, like adverse lifestyle, bad eating habits, not sleeping well, chronic stress, smoking, excess alcohol consumption. All you need to act at this root level, grassroots level, for you not to have a repeat cardiac event. So unless you do the risk factor modification, your management and treatment plan is never complete, and only angioplasty is not the answer.
So angioplasty is a life-saving procedure, but after angioplasty, somebody is having a bad lifestyle.
Repeat events can happen.
Again,
reblockages,
so
everything can
in
happen.
your experience, how many restenting you have done? Just it.
So, with this latest generation of stents that we are using currently, in fact, the chances are very low.
Okay.
If the patient follows the lifestyle, reduces the risk factors, and takes the medication on time, it is hardly less than 1% chance of procedure happening.
So I'll clarify this from the audience, like you told that the recent generation stents. So what was the change that happened in the stents 10 years ago and now?
Okay, so basically stent is a metal scaffold over which there is a drug. So metal scaffold holds we open the artery via balloon, then we put the stent. the metal scaffold holds the vessel, and this drug which is coated inside prevents the further reblockage happening over time, months or years. So better metal scaffolds, better designs have been developed, and better drugs are there these days. So by the virtue of which, compared to the older generation stent, now the third and the fourth generation stents are far better in terms of the reblockage rates.
So in terms of a cost, how much a stent will cost? Good stent will cost now.
Thankfully,
suppose somebody comes to you for a angioplasty Manipal hospital. Okay, for a single stenting. So how much approximate cost? What is the cost?
See, the very good thing that has happened in India currently is the government has capped the stents. Even US FDA approved stents, there's the foreign stents, imported stents, they have to be charged only at 40,000. So that's the cost of the stent per se. But if you go for a complete procedure, inclusive of 1 day ICU, 2 days in a ward, medications, all the other investigations, cross consultations, rounds by other specialist doctors, somewhere between 2 to 2.5 lakh is the bare minimum, I think, which comes in any corporate hospital.
So before capping the stent used to cost 1.5, 2 lakhs.
Yeah, it was almost, there was a stent which was more than 2 lakhs as well.
Yes. This is to be noted, earlier there's no capping on the stents. Now there is a capping on the stent. Why the charge goes high is patient may need ICU admissions and 2-3 days ward care, so many medication to be administered along with that. So this makes the cost approximately around between 2 to 3 lakhs.
Between 2 to 2.5 lakhs for a single stent straightforward angioplasty, I would say.
So if it all goes well, it's around between 2 to 2.5.
Yes.
Okay. So next I'll come to the lifestyle prevention. Now there is a very popular myth: 10,000 steps walking is good, and 10,000 steps is a magic number. It's okay. So what is your opinion on this?
Now,
is 10,000 only necessary? Even 8,000 is also okay.
So now I will go by the data. What the American Heart Association says, this data has come from good trials and good evidence. See, what American Heart Association recommends, and American Heart Association I am quoting because that's the gold standard for guidelines all over the world as far as cardiovascular health is concerned. 30 minutes of low to moderate intensity exercise every day for at least 5 days. That is 150 minutes per week. There is nothing like these many steps, that many steps. So 30 minutes of activity, mostly cardiac activities like brisk walking, jogging, swimming, dancing, aerobics, treadmilling. Maybe you can just combine with a bit of light weightlifting. That's all that is required. So if you are feeling that if you do 2 hours of exercise, you are beneficial, more benefit? No, not at all. It may be detrimental also. So moderation is the key, is what I would say, and there is no one rule which fits all. For elderly people, maybe 20 minutes of walking is enough. For young fit people, maybe they can push themselves to 1 hour.
So 10K is not mandatory?
Absolutely not.
Even at least 6K?
I would say now, there is no recommendation, I would say anything above 5K.
5K is good. Okay, we can consider at least 6K is minimum. If you have a time, walk till 8K, 10K. But nothing, don't get obsessed with 10K steps per day. That's a message. Yeah. And I don't want to ask you the general question what is the diet and all. So you are a fit, young cardiologist with a maintained fitness. What you eat personally to maintain your heart health?
Okay, I'll be very honest here. I've been blessed with good
So you are also busy. You are also having a busy life. Sometimes you end up in stenting. You may have disturbed sleep because you have good emergencies. All these things. Many of the Indians live in a similar situation. They also have a stress and all. So how you balance your what you eat in a breakfast, lunch, and dinner, and what you preferably avoid. And also you tell me about the weekends.
See, to be very honest with you, I've been blessed with good genes. That's why probably I'm physically fit. But good genes are not going to take you long. Especially when you cross 35, then you have to work on your body. So what I basically do, and I am not in a very high stress job. When I'm operating on a major heart attack case, the life is in my hands. It is a do or die situation, and my stress levels are really very high. I will not say that I'm a very cool person, I don't care, I just go and do it like a machine. No, my stress level spikes up when the patient is going bad, comes in with a bad attack, and there's a complicated stenting, any complication happens, it shoots up. So what I personally do is, I've worked a lot on my body. I everyday exercise for 1 hour, I've joined gym, I do it for 6 days at least every week. I do make a time, I wake 1 hour earlier now, this I've inculcated over the last 2 years. Make it a point to start off with gym in the morning. So that's for the physical activity. Secondly, meditation and deep breathing exercises. Whenever I feel very stressed, I just take a break and I deep breathe for at least 5 to 10 minutes. Deep breathing is nothing but belly breathing. Other than that, I've even Do good meditation.
Specific to the food.
Yeah, I'm coming back to now in diet. Now, diet also plays an important role, and diet can make you anxious. Certain kinds of diet. So I have cut down the sugar level in my diet as much as possible. I'm not a diabetic, but sugar can cause anxiety and can increase your stress hormone levels. Secondly, very good hydration. In summers, at least 3 plus liters, and in winters and rainy season, at least 2.5 liters plus. And mostly a vegetarian diet is what I have inculcated of late. Avoiding eating out, oily food, packaged items, junk foods, bare minimum. All of this contain trans fats, which can be detrimental to your cardiac health. And caffeinated drink. I don't have bad habits. I don't smoke. I don't drink. And even tea, coffee, I consume only 2 times a day, and I made it a point. Initially, I was consuming more, and I could feel that I was more anxious. By doing this change, now I feel a little bit less anxious. So, good exercise, proper diet, good hydration, and a little bit of mental exercise like meditation, pranayama, and deep breathing. All this together, exercise for your body and mind will take not more than 1 hour per day. Please inculcate in this in your everyday lifestyle.
So in one point I noticed here is you told about I read the sugars.
Yeah.
So most of the things like people think that heart disease is not the cholesterol. They don't think that sugar is the issue. So whenever I go to restaurants, one day I was asking for a sugarless coffee or a milk sugar. The person next to me asked, Doctor, are you diabetic? So this is a myth. People think that if you're drinking sugarless or milk sugar, they think only diabetic will do that. So everyone should cut down the sugars. I read one book called PUB Diet by Dr. Asim Malhotra. In that there is a 3 lakh case studies where they found that patients analyzed over a period of years. Like 50% people who got heart attacks have normal cholesterol. So in that way, which one think sugar causing insulin resistance is a more risk factor or cholesterol is a more risk factor?
Very tough question to answer, but I'll go by the numbers here. If you look at the numbers, diabetes causes more heart-related problems than high cholesterol. In fact, if you look at the data, if you look at the guidelines, diabetes has been referred to as a cardiovascular equivalent. By that you mean, what it means is, if you are having diabetes, that means already cardiac things are started. That is what it generally means, to tell in a very layman language. So I think high sugars is a little bit of more risk factor than high cholesterol.
So correct. And this is one of the important point to know that common public myth is only the cholesterol is the cause of heart diseases. And sugar is equally bad. And there is one very nice sentence in I read a book, Homo sapiens. In that book, this is about the history of the humankind over millions of years. It is sugar kills more people than any wars, suicides, worldwide. That is, sugar is more dangerous than a gunpowder. That was a very nicely put it in. Sugar is more than ice, but now we had India-Pakistan war. It made a lot of news. High sugar intake is causing people millions of die every day, but it is silently killing. Nobody is noticing it. So sugar is more dangerous than cholesterol. So then, and some people like do skipping breakfast or intermittent fasting. So what is your view on that?
Okay, I may piss off a lot of people here, especially the people who are promoting all of this. But what has been my observation is, as I practice everyday cardiology, and many people end up with problems with this extreme diet and extreme exercise measures. Only one sentence: none of this extreme diet or exercise measures are required. Moderation is the key.
So you're saying it's a Buddha way. Buddha always says, go midway.
Yes.
Don't go any extremes.
Yes.
Okay, let's come into some real risk factor analysis and all. So what are the silent signs of heart disease people often ignore?
Okay. See, this is, I think, very relevant question as far as the general public is concerned, because as far as heart attack and heart disease is concerned, everyone knows chest pain. Now, that's the most typical symptom. This chest pain usually comes in the center of the chest. On the left side, it may radiate to the inner side of your left arm, left side of the neck, left of the jaw, and something somewhere near the upper abdomen. You walk some distance, the pain comes, you stop, the pain goes away. This is a very typical anginal symptom. This happens in up to 80 to 90% of the people who are about to have a heart attack or this blockages are developed. Most people don't miss out here. These days, especially in metro cities, chest pain, they come directly to cardiologists these days to get the things evaluated. But what I want to tell you is 10 to 20% of the people do not have chest pain, even when they have a heart attack. Forget about the early stage blockages. This is called a silent heart attack. And the silent heart attack doesn't mean that you have symptoms. Silent heart attack means you don't have the typical symptom of chest pain. That's what it means. So there are atypical symptoms which 10 to 20% people have. Now I'll tell you which people can have this atypical symptom. One is women, second is overweight and obese people, third is diabetics, high sugar level,
Diabetes people with uncontrolled sugars.
uncontrolled sugars, and fourth is elderly, more than 80 or like more than 60. These four subgroups are more likely to have atypical symptoms in a heart attack or heart disease rather than typical symptom. And these atypical symptoms that also enumerate breathing issues, palpitations or your heart pounding faster, weakness or fatigue on walking. So when you are exerting yourself, you are not having chest pain, but you are going out of breath, your heart is pounding like anything, you are becoming weak. And fourth, I think the most commonly missed atypical symptom is gastritis-like symptom. In the upper abdomen, there will be some burning sensation. You go to a local physician, someone gives Pantop, 2 days, nothing happens. You go to someone else, someone gives Rantac, the third person gives injectable antacid, nothing happens. And finally, someday, the patient lands up in ER with a major attack. So this gastritis-like symptom, especially your risk factors like sugar, cholesterol, BP, family history, you are a smoker, more than 40 years of old, and not getting controlled with usual antacids, please do an ECG. It can be a heart attack mimic.
So 1 second, so basically explain some people with I even have seen when people come with the gastritis symptoms, when you really see typical heart attack, I refer them.
I get at least 2 heart attacks from the gastroenterology department OPD every month. They have gone to the gastroenterologist and gastroenterologist did the evaluation, found something is MS, did a ECG, major attack, then referred to us.
So best thing is any kind of typical even in gastritis pain, if it is causing discomfort to you, get an ECG.
Yes, get an ECG done. And also don't over panic. Now, there are some people who are very negligent. At the same time, there are some group of people who are over cautious. They get panicked with everything. So, not every gastritis. I'm not saying that you are having gastritis, you should suddenly run to the hospital. If you do not have any traditional risk factors and you don't have any strong genetic history, and if you are less than 40 years of old, 40 years of age, you can just take the routine and if it is not getting controlled with antacids, then you go and get an ECG. That's what I suggest.
Okay, that's good. And nowadays, the preventive health checkup is a common, even the many companies promote angioedema. And the remote preventive health checkup. Coming to the who should really get a heart check, heart evaluation, and really at what age they should start checking heart.
Another very relevant question. Many times it happens. We get a patient in emergency major heart attack and put the stenting. Then we do the risk factor analysis, all blood tests, cholesterols are high, sugars are high. They come to know them after heart attack. Then ask them, why are you doing this? Why you didn't get yourself checked? You could have checked this every yearly once you would have known. You may not have had heart attack only. They say, I didn't have any problem. Why should I go to a doctor? Why should I get a blood investigation then? I didn't have any symptom at all. So over the last 50 years, I've never visited hospital. All these kind of boasting statements they say. I have one thing to say. I ask them, you own a bike or car? They say yes. Do you service it every year even if it is running properly? They say yes. I ask, why do you service? Just to see oil changing is required, all parts are running properly or no. Your body is the biggest car which you are having. That's your biggest investment. There are so many diseases which in the initial stages don't have any symptoms. You'll be running, doing everyday activity and the disease is slowly coming. Like you do your yearly maintenance for your car or bike, get a preventive health checkup done. Simple things. Cardiac checkup end to end, that includes an ECG and treadmill, sugar test, cholesterol test, thyroid, hemoglobin, kidney test. These 6 tests yearly once.
HbA1c.
Yeah, the sugar means FBS, PPBS and HbA1c. If you
And
do
what
this,
age, what age you should start checking heart?
nowadays there is no age at all, sir. Initially it was less than 60 was called a younger heart attack. Then it became less than 40s in younger heart attack. Nowadays I am seeing regularly sending patients in 20s and 30s.
So at least 30 years almost?
20, sir. I would say 20. If you go by the guideline, it is 40 years you should be doing your first health check done and every 3 to 5 years. That's what the data says. But I would want to be more aggressive seeing a situation in current day. By 20 years have your first health check done. Every 3 to 5 years you do till you are 40. Then after 40 yearly once you do. I myself do 6 monthly once.
Yeah, this is a good sir. And one more thing was talking about the vehicle servicing. So the same question was one of the next patient was asking. So I told him, if you do vehicle servicing yearly or regular basis, still there is a chance of vehicle breakdown. And if there is no vehicle servicing, what are the chances?
The more chances are far more.
The vehicle may collapse at any time. The question asked to me is, sir, people who do all the checkup yearly, they are also dying. And people, I don't want to check anything, let it come, what happens? The real is, if you do it servicing regularly also, there is a chance of some risk, some hospitalization. If you don't do servicing only, don't even think of, definitely there is a high chance of collapse.
I would want to add here, especially as far as heart attack, some people even after getting the ECG code TMT done have this land up in heart attacks, but that is a very minority, less than 1%. Most of the blockages are picked up in these tests. So it is very unlikely, and it does happen. I'm not saying that if everything is normal, your chance of heart attack is 0. It is never like that. But 99% it gets picked up. So please do the tests.
So even to say, even a person of 30-35 years also should worry of cardiac arrest, sudden cardiac arrest.
I wouldn't say worry. I think they should be wary of it. I mean, they should be having an idea of it and making the necessary changes which will prevent it.
So how do you value this history of family history of heart attacks?
One of the topmost risk factors, sir.
Okay.
If you go by the data and if you go by what we see regularly, which again matches the data, diabetes, high sugar, high cholesterol level, family history, smoking. I think these are the top 4 risk factors for heart attacks.
Okay. So for example, one family, most people get heart attack at the age of 55-60. Okay. And I see their kids, even at 30-35, they have a family history. So family history, old age is also significant. A family history, somebody is having a family history at 40-45 years, is significant.
See, family history is family history. No matter at what age your parents had it. Accepting some very old elderly people like 80 years old and having a heart attack, that we can little exclude. Before that, if the person is having heart attack, that adds up to your family history.
So it's a very significant factor.
Yes, significant factor.
That's good. Okay. So then we'll move on to some practical wisdom for the public. So somebody is in living, first I started with Bangalore people. When somebody is living in an apartment kind of thing, they get a chest pain, suspected to be heart attacks, feel like cardiac problem. So what they should immediately do, step by step.
Okay. See, now this is a very relevant question because the sudden deaths in heart attack happen in the first hour, which is called as the golden hour. And many a times it happens you cannot reach the hospital within this first 1 hour. So what you need to do yourself is what matters. There are 3 medications which I'll tell you, which everyone should be having in their home. One is Disprin, that is the soluble chewable aspirin 325 mg. Second is atorvastatin 80 mg, and third is sorbitrate 5 mg. All of these 3 things are not dissolvable tablets. You can just keep it. It suddenly makes your blood thin within minutes, and even if there is a major clots, they get diluted and dissolved. So you will buy time. Your chances of having a cardiac arrest is very less if you take these medications and then go to the hospital. Of course, you have to go to the hospital. It's not that you take that and sit in home and the pain goes away. Pain may go away with this because the clot may get dissolved, but the blockage will still be there. So you have to visit the hospital. I think these are the emergency medication which everyone should be having.
Very valid answer by Dr. Pavan. And these are 3 drugs: Disprin, statin, and sorbitrate. Everyone should keep in their house. Disprin, what is the dose?
325.
No, people in India now, they're very fancy about home remedies like that and this. At least these are life-saving drugs. Everyone should keep at their homes, and everyone themselves are, for the elderly over it is at least life-saving. So just have it. And in Bangalore, like unless it's stuck in traffic, you can reach any good hospital within 30 minutes.
Yes,
that's a good time. And can nowadays smartwatches, even have smartwatches? Can smartwatches really detect heart attacks?
Direct answer, no. They are not meant to detect heart attacks. There are some things which the smart watches can detect. That is a low heart rate or high heart rate, abnormal heart rhythm like atrial fibrillation. I think these are the only 2 things which the watch can detect. Heart attacks, absolutely not. Maybe the technology needs further improvement. There may be years down the line where you can have everything in the watch, but not today.
So some people for many people cannot afford. They think that okay, if you go to hospital, they will do that test and all. What are the best affordable tests, simple tests, to know that your heart is healthy?
Okay. See, at least get an ECG done. Bare minimum yearly once. Bare minimum. So if there is any major problem, the ECG will pick it up. Nothing else.
And nowadays there's a lot of supplements like coenzyme Q and even home remedy, garlic supplements or magnesium supplement, something. So what is your view on that? Can somebody to take, I'm not telling that supplements are the only thing. In addition to taking supplements, they really help on what your recommendation for taking supplements?
Now, this is a very common question that my patients ask to me. So what it? See, I will have a balanced take on it. These supplements are not harmful. If you want to take, you can take it. I'm not going to say they are harmful to you. But as far as the efficacy or utility is concerned, as an evidence-based cardiologist, we go by evidence and trials. There is no good evidence that they will actually protect you. There may be one-off incidences in one-off people where it may actually help, in most it may not. But if you want to take, you can take it.
And tell us a real story when you were introduced as a cardiologist, you're practicing in decade in Bangalore. The real story that changed your perspective about heart attack. And we really thought that, so I chosen as a cardiologist, and after seeing this episode and other things, was something new, awakening has happened within you.
Okay, so see, I became a doctor per se because I think this profession is special compared to others. This is why I came to medicine. We have this healing touch, we can save lives, and I took cardiology because I personally feel this is the most dynamic department wherein we can actually save patients who are almost dying. And this was reaffirmed when I started practicing cardiology. We see so many patients every day almost dying, coming in a very bad state. We have to put them on ventilator. BP is not there, heart is barely pumping, major heart attack. We immediately take up for an angiogram, open up the vessel via an angioplasty, and it like magic by evening the ventilator is out, the BP support medications are out. To tell an example, there was a case couple of years back where even I had given up. Patient was pretty young. He came in a very bad state, immediately crashed inside the ER, intubated, 3 inotropic support, 3 rounds of CPR done. His body acid levels have started to increase. I thought no matter what we do, he's not going to survive. The family was in shock, but they let us do the procedure. I just gave them less than 1% chance of survival, but they were supportive and they said we want to take all the chances. We did a primary angioplasty patient, walked home, and till now this is my follow-up. What I learned here is we as doctors should never give up. Never ever give up.
It's a good message. And in your experience, what is the youngest patient who had heart attack and you treated? Youngest patient?
Just 2 months back. 19-year-old boy. He had some risk factors which I will not be taking the names and all here, but he had a strong risk factor like recreational drug abuse. I had to stent him. His major vessel, the LAD vessel, had a complete 100% occlusion, threw up an attack. Thankfully could reach the emergency in time. We took him up immediately. Currently is all fine.
This is the right message. I think audience, you heard it. It is 19 years. Now our Bangalore is becoming a top city. Earlier it was Silicon City. Now it's a top city. I think number of tops which came up in the last 5 years. I think it has been never seen in 15 years back. I am in Bangalore for the last 20 years. Never seen of every. Once upon a time the pubs were only in MG Road, Brigade roads. Now we see even JP Nagar has multiple pubs. And the culture that people just go there, drink and other things, they think that we are saying nothing will happen to me.
I would also want to take this platform to put this message across the youngsters. Smoking is really bad, you really need to stop it. Forget about recreational drug abuse, you should never ever be doing that. Alcohol, best is to avoid it. Next best is to take it in very limited quantity, like just once a week, not more than 30 to 60 ml. And please be very careful. In the exuberance of youth, you will not realize that you are increasing your future risk of heart attack by involving in such risky habits. Be careful.
When it comes to alcohol, common question asked is, so which alcohol is too bad?
See, alcohol, sir, I will tell you, if you look at the latest WHO statement last year or the one before, it says alcohol, whichever alcohol in whatever quantity is bad, there is no beneficial effects of alcohol. Before that, there was this by the American Heart Association saying that in low quantities alcohol may be beneficial. They used to say 1 drink per day for women and 2 drinks per day for men. Although those studies were all done in Caucasians and the Negro population whose body surface area and body weight is 1.5 to 2 times of us Indians. So overall, I will tell you very simply, alcohol in any quantity is bad. And if you want to really take beyond this, not more than 1 drink or 2 drinks per week. It doesn't matter which alcohol it is.
Many people have the opinion that drinking a beer is not that unhealthy. That is casual. People probably telling that I just have beer, doctor. I don't have whiskey.
Yeah.
But many of them, I think beer is more unhealthy because it is more of sugar.
This is a very common statement. When we ask about alcohol history, they know. They say no. Then the wife usually tells he has beer. He says beer is not alcohol. That is not considered. So beer is also alcohol.
And even in cocktail also people think that these cocktails and beer contain more sugar than the real whiskeys and gin and vodka. So now I have some 5 rapid fire questions. Cholesterol or sugar, which is worst?
Sugar.
Ghee, good or bad?
Depends on the source. Overall bad.
Cow's ghee, as many Indian believe.
In moderation and small quantity, like 1 teaspoon per day, absolutely okay. Not more than that.
Should Indians eat eggs daily?
Yeah, if it is 2 to 3 eggs per day, you can eat the whole egg. And beyond that, if you want to consume for the protein sake, only egg whites, boiled egg whites.
Fish oil, omega supplements, must have or waste of money?
Waste of money.
Okay. Can yoga help heart?
Absolutely, it does. Yoga calms your mind, reduces your stress hormone levels, and which will be a cardiopulmonary effect.
So, last segment we come to the future and technology and modern technology how related to the heart care. So, are smartwatches and artificial intelligence, what impact it make in future heart care?
It may make him see because some things which he never imagined before are happening now. So, down the line, years later, there may be artificial intelligence which will be able to detect the future risk of a heart attack, but to date, there is no such technology.
And what do you think about CT coronary angiogram? Now feel I think it's very good. Many people who refuse to go to hospitals inside and get angiogram, they're ready to go to get CT angiogram because it is just 3-4 hours procedure. What do you take on that?
See, CT angiogram I think is over-utilized in India than it should be. Basically, I would suggest just put the ECG code TMT, and if there is any variation and your doctor has doubt and your symptoms are not matching with the test, then go for CT angiogram. Else, if there is a major variation, they will anyways tell you the invasive angiogram. Or if you are not able to do the TMT, in that case, CT angiography or routine screening for a person who has a very strong family history. These are the simple things wherein CT angiogram has to be pushed. We are not in everyone, just ECG code and TMT. And you may be wondering why not CT angiogram, because that involves radiation exposure. Although the current generation CT machines have very less radiation exposure, but still there is a risk. And secondly, we use contrast agent where it can have some allergic reactions in some people, kidney related issues in some people, although your doctor would have taken all the care for you not to have any issues with that. But these are the minor risks, so do it only if it is essential, and that's the reason diagnostic doesn't do CT angiogram without prescription. You go and walk in and say echo, they will do, they will not do the CT, they'll ask a doctor prescription. So if you are planning and have some things like getting a CT done, meet your doctor first, take his advice, and then go ahead with the CT.
So now the practical experience, 3 things. One is TMT, second is CT calcium score, and CT coronary angiogram.
Yeah.
So whom you advise these 3 tests? And which segment, which category?
See, for a routine screening, if you ask, TMT for everyone, other than probably very elderly people who may be at risk if you make them run on the treadmill. CT calcium score, I think, is not a very good investigation because it just gives the calcium score, it doesn't give the exact blockages. CT angiogram, yes, we can do it.
But even some young people also, like not seen even 30, 40, 45, obese, joint issues, they can't do TMT.
Yeah, if you can't do the TMT, then we can go with CT angiogram per se. CT calcium score, if there is any kidney related issues, we cannot use contrast agent, then probably we can go with the only calcium score, at least to have some idea.
So, can it not be equivalent to TMT, CT calcium score?
No, sir.
No.
Because the calcium deposition in the coronary vessels, heart vessels, can happen inside the lumen or outside the lumen. So, it doesn't correlate. I would suggest TMT is better than that.
So, can somebody track their heart issue only with the fitness trackers?
It's impossible to have the complete things, but yeah, like I said, low heart rate, high heart rate, and irregular heart rate called as atrial fibrillation can be easily tracked by the current generation smartwatches.
So you see somebody having suspected heart attack. So instead of wasting time on recording ECG in the smartphone, have some whispering starting.
Yeah, take the emergency medication, go to your nearby hospital, get an ECG.
So even though technology is there, don't rate too much in technology and don't forget the basics. Have sorbit rate, starting and disk rate. So very nice information and very thank you Pavan. You've given very nice insights, and I think you people have got some really good information from a different perspective, practical aspects, technology aspects, starting what you can do at home and how young people are dealing with heart diseases. So we'll end this session right now, and we'll have this short session on CPR. Yeah, one more important question. We see in this the flight will going where in the air somebody got suddenly collapsed, could be heart attack, something else, and we have many stories also. Somebody did a CPR, sometimes successful, sometimes not successful. So how practical should assess it? Suppose I am going in a flight, I am a layman, I am not a doctor. Someone suddenly collapses next to me. So what I am supposed to do as a common person?
So, if a person suddenly collapses, the question remains whether there has been a cardiac arrest, whether the heart has stopped pumping or not. Ideally, first you should go, and if you know their name, you should call out by their name, or at least say, "Sir, madam," very loudly, see if they respond or not. This should be in the first 2-3 seconds. Next, just pat them and see if they show any response. This should be again in the 2 seconds. Third, go for the radial pulse. If you keep the pulse here, if this is not there, at least go for the carotid, that is the best. Keep your finger here beside the throat, airway. I think we'll take this. Tumba jargon ತರ ಆಗ್ಬಿಡ್ತು. So the question arises when a person suddenly collapses, whether the person has a cardiac arrest or not. Cardiac arrest basically means heart has stopped pumping, and that's why the patient has collapsed. What you need to do first is call out to the person's name, or say sir or madam if you don't know the name, and see if the person wakes up or shows some response. This should happen in 2-3 seconds. Next, pat the person and see if any response. Again 2-3 seconds. Third, go for the carotid pulse. If the person is still not showing a response, keep your thumb beside the airway here in the neck and see if there is any bounding pulse. If still not there, this again, all these 3 things: calling name, patting, checking the pulse within 5 to 6 seconds. Then you need to start the CPR, which is going to be the life-saving measure for the person who has collapsed beside you. And how CPR has to be done, what are the techniques, the guidelines, we will deal in the next video.
Do you think common man can do CPR?
Yes, absolutely. I think everyone should be knowing to do the bystander CPR. It is a life-saving skill.
So CPR must be known to everyone, so that you don't know what happens what time you're going in a metro, you're train, you're traveling some destination, somebody collapses you, and this CPR. And what is the people common? We know in doing the demonstrated registration, what are the common mistakes people do with CPR? I heard some people do the chest grips while doing exposures.
The most important mistake that people do is not initiating CPR. That is what I feel.
This is very essential. Whether good or bad, start
the CPR. Don't worry about breaking the ribs and all. If you are breaking the rib, you are doing a good CPR. And the rib fractures do not require any surgery. They auto heal in 2 to 4 weeks. So don't worry about breaking bones. If you are breaking bone, you are doing a good quality CPR. We will deal with this, all the points, myths, facts about CPR in our next video at length.
And in the normal, theoretically, and in the practical experience, clinical experience, what is the success rate of CPRs?
See, success rate is somewhere around 25%. That is far more than 0%, right? So you should be doing CPR.
This is very important. You may not save 100% people. There is a high chance of saving 20 to 25% people. So CPR is essential. So next session, next block, we come up with a detail how to do CPR practically.
Very essential. Some European countries, they give driving license only after they know the person knows CPR. That's mandatory.
So especially in India also, all the Ola, Uber drivers, and even the pilots, aircrafts, everyone should know, aware of the CPR. Better they have certified CPR.
Yes.
If they are certified from a good institution or good things, at least they boost their confidence. And even the attendant who are having CPR with them also, they have more confidence in them. That's it. Hi. Of late, we are seeing a lot on social media. Many young people in their early 30s, 40s have sudden cardiac arrest. Suddenly they fall and die. And sometimes it is scary why people are dying. One could be a cardiac arrest, and some people say it's a post-COVID vaccination thrombosis effect, and it could be a silent myocarditis, and so on. So this sudden cardiac deaths in young people, especially in India, is alarming, and it needs some attention. So why it's happening? What we can do to prevent this? So what has happened is happened. At least what precautions we must take. Young people in their early 30 plus and 40s, so they'll prevent these cardiac risk factors and sudden cardiac arrests. So I made a simple list of a preventive heart screening diet. So this everyone should know for themselves and for their family members. The first thing is, if somebody is 30 plus, so don't think that heart disease is already seen in the social media and all. Even people at 30, 35 also suddenly dying of heart diseases. 30 plus, the basic things to be checked at least once in 6 months to once a year. Your BP, blood pressure. Blood pressure is a silent killer. So check at least BP. Even if you don't have BP, check your BP once in 6 months. And if somebody is having a BP, I suggest keep an electronic BP apparatus at home and check weekly once. And some people are very much obsessive, they keep checking BP every day, once or twice. Don't do that. At least your BP is fairly under normal. Once a week is enough. And if you don't have a BP, at least make sure that once in a 6 months check your BP. Because blood pressure is a silent killer. Second comes your cholesterol. This is now there in most of the health checkups. At least people who are 30 plus or risk factors, once in 6 months or once in a year, check your cholesterol. And in the previous videos, I made a list what all you look for in a lipid profile report. Second thing is check your blood sugars, FBS, HbA1c at least once in a year. So many people I have seen in a clinic, they suddenly come with HbA1c 9, 10, people in the early 30s. And when I ask them, when was your last blood test done? They say 3 years ago, 4 years ago and all. If you are having mild risk factors also, if you yourself feel that you are not maintaining a healthy lifestyle and you are too busy or all those things, check at least once in 6 months or 1 year without fail. Third is ECG. So whenever ECG, just tell about ECG, we cannot diagnose everything. At least you come to know about heart rate, any indirect evidence of heart blocks and all. ECG, whenever you're getting a health checkups, make sure that include ECG also in that. Same thing, 2D echo and TMT. 2D echo and TMT, at least better to get it once in 2 years. 2D echo, basically they say, they do with the probe, it will show the structure of the heart. Whether heart is enlarged, what is the function of the heart and all. Treadmill test, like you have to run on a treadmill and your ECG and heart rate pattern will be recorded. This treadmill test will indirectly tell you whether you have heart blockages or not. So get this done once in 2 years. And now there are many things, many refined, many advanced things have come. Like a CT coronary calcium score. So somebody is a 40 plus and to know the risk or you're already having a risk factor, there is a test called CT coronary calcium score. This is like a, indirectly I can say this is CT scan of the heart. Here they will see the plaque score, they will make it as calcium score. You need not do any fasting and it will take hardly 5-10 minutes and the risk of radiation also very less. So they do CT coronary calcium score just like doing a CT scan and no injection will be given like a contrast injection and you come to know your score. If it is less than 100, it's okay. If the score is above 100, you have a mild risk. If the score is above 400, then you have a high risk. This high risk is there, either I just directly go for a CT coronary angiogram or a regular coronary angiogram. So what is this CT coronary angiogram? So now it is becoming more and more popular because many people cannot go treadmill test because many have a joint issues. So the modern diseases like many people in the early 40s itself having a joint issues nowadays. Many are obese, they say they can't run. And anyhow, treadmill test given indirect evidence, they don't want to run and see. CT coronary angiogram is give a proper clarity. That means it will exactly show which of your arteries having a blockage. 30%, 40% blockages is there or not. So it will give almost a similar report like a normal angiogram you get with a cardiologist. So in this way, CT coronary angiogram is popular. To get a good CT coronary angiogram, the CT scan should be that 125, 123 is the minimum. So many diagnosis centers have a normal CT scan of 30, 64 slice CTs. So these 64, 34 may not give you the accurate diagnosis. Any CT scan having 124 and above will more or less give a accurate diagnosis of a CT coronary angiogram. So many people who are 40 plus or under risk, I advise them CT coronary angiogram. How to get it done? So first of all, CT coronary angiogram is like getting a normal CT scan. What you have to do? You need at least 4 to 5 hours of fasting. So then you book an appointment with a diagnostic centers or a hospital where they particularly do the CT coronary angiogram. There they will give some beta blockers to reduce your heart rate. To give a proper clarity, your heart rate should be less than 70. If the heart rate is more than 80, 90, 100, at the time of doing CT coronary angiogram, there will be some problems in the reporting. So they will give some beta blockers to reduce your heart rate and they will give a contrast injection and take a CT scan and they will report in such a way that it is like almost normal coronary angiogram where which arteries, LAD or whatever the arteries comes, what percentage of blocks, and your doctor will interpret if it is a significant block, then you have to go for a angiogram with your cardiologist, and if it is very insignificant or normal, at least you have to make sure that your heart is normal, you have no blockages. So these two, CT coronary calcium score, the difference is in the coronary calcium score they won't inject any dye and it is just 5-10 minutes. The CT coronary angiogram